I got into medicine. As growing up, I had a mother with healthcare issues, and so she was in and out of hospitals and struggled with mental health. When we talk about mind, body, spirit, it's really hard to think of anything that's more important than mental health. And we need to get past that stigma that people have, especially men, in talking about their feelings, their emotions, or even the thought of struggling. We don't want patients to feel like there's things that they can't tell their physician. We want our patients to come into our offices feeling like they're seeing a trusted confidant, feeling like they have a relationship with their provider that is almost as sacred as they have with anybody else. Regular exercise promotes better mental health. Doesn't mean that there's not a role for things like medication, things like therapy. Mindfulness-based stress reduction, which is meditation-based, is a really incredible tool for helping people manage anxiety or even mild depression outside of medication. Diet plays a crucial role. We know things like omega-3 fatty acids help with overall brain health. If we're eating healthy foods, we're giving our body the nutrients that it needs, your body's gonna feel better. Your mind, as a result, is gonna feel better. Sleep is probably one of the most important pieces for mental health. So we can make really mild strategic changes, incorporate behaviors that can drive to better sleep. And if you give the brain time to relax and rest itself, you wake up with a better perspective. Stress management is key and probably the easiest intervention. I know often when you try and break down what's really stressing out a patient, they're worrying about things that haven't happened. And that cognitive burden of just worry doesn't need to happen. And meditation and mindfulness really will change how you perceive your environment around you. Social connections are key, and this is one thing that was really challenging with the pandemic. People lost a lot of their ability to fellowship with one another, and really terrible for mental health. But we know the vast majority of people do better when they have at least a small number of very close friends or family members that they can interact with. Mental health isn't something that you have one visit and then you're feeling better and cured from. It's visits over time. It's a journey. It's not a quick fix, and it's really important that we engage you with proper therapy, the proper team of individuals that provide care for you, and make sure that you have ongoing access to care. That's essential.